My son does not like the mask. Do I have to use it?
That's a really common problem, but in fact, not using the mask with the nebulizer decreases the amount of drug delivered by a great amount. Just holding the nebulizer a quarter of an inch away from the face decreases it by 50%. And holding it 3/4 of an inch away, you'll only get about 20% of the dose actually delivered. There are several reasons why you need to use the spacer. If you put the mouthpiece directly in the mouth, most of the drug gets deposited on the palate and the back of the throat, and you really don't get much delivery. You also tend to get a lot of leakage. The spacer really improves the efficiency of delivery of drug from a meter dose inhaler. Usually, if a child is old enough to hold their breath to a count of 10, they can use a spacer without the mask on it and just the mouthpiece. It'll vary somewhat, but somewhere between 4 and 6 years of age is generally the time that happens.
Can I give a treatment while my son's crying?
When your child cries, although he seems to take big breaths at times, this is really not a very good time to use an inhaler or a nebulizer. Crying decreases the delivery of the drug significantly.
Can I give a treatment while my son is sleeping?
Actually, giving the treatment while the child sleeps is not a bad idea. The amount that actually gets into the airways is sufficient to do the job.
Is a nebulizer better than an MDI?
Actually, the nebulizer isn't better than the MDI. The most important thing is that your child tolerates whatever technique you're using. But an MDI with a spacer and a properly fitting mask or mouthpiece can be just as effective as the nebulizer.
Is my child old enough to use an MDI?
You can use an MDI at virtually any age with a spacer that has a properly fitting mask or a mouthpiece, depending on the age of the child.
How can I tell if my MDI is empty?
We like people to use MDIs these days that have built-in counters. That's really the most effective way. The other alternative is to count. In the old days, we used to tell people that they could take out the canister and see whether it floats or not, or shake it. But really, with the new propellants that we have in the modern inhalers, that doesn't work anymore, and it's not recommended.
Why do I have to prime the inhaler?
You should prime your inhaler every time you get a new one, or if you haven't used yours in quite a while. The first time, or a couple times you pump it, there'll be no medication, just the propellant, which helps the medication come out. You should look at the packaging, because every brand is different on how many times you need to prime it.
I've heard that steroids are dangerous. My child was given prednisone in the hospital. Are steroids safe for my child?
It's safe to take steroids for short periods of time, such as for an asthma exacerbation. When you take steroids for a longer amount of time, it can cause problems with different parts of your body. The main concern is with growth or causing problems with your bones or diabetes.
Are inhaled steroids safe?
Inhaled steroids are very safe. They're given in a much smaller dose than you would get with oral steroids that you would take, for example, after a hospital admission for asthma. When you take an inhaled steroid, the steroid goes right to your lungs, and so we can use really small doses. The most common side effect with inhaled steroids is thrush, which is a yeast infection in the mouth. Even though that's the most common side effect, it's also relatively uncommon and is easily treated with oral medication.
Why should I give my daughter a medicine every day when she's not sick?
In children with persistent asthma, it's recommended to use a daily inhaled steroid. We use a daily inhaled steroid to prevent severe exacerbations requiring systemic steroids.
Does he need this medicine forever? Will he ever outgrow his asthma?
The children who develop asthma symptoms later in life, have severe allergies, or a strong family history of asthma tend to continue to have asthma more frequently.
I've heard that long-acting beta agonists are dangerous. Are they harmful for my child?
Long-acting beta agonists should never be used on their own to treat an asthma exacerbation. They should always be used in conjunction with an inhaled corticosteroid. They should never be used to control asthma in children who have been well controlled on other medications, including a daily inhaled steroid. If you have questions about long-acting beta agonists, you should ask your child's doctor.
Should my child have allergy testing?
Most children with asthma do not require routine allergy testing. If you notice your child always has asthma symptoms after exposure to a certain allergen, we would recommend that you avoid exposure to that allergen. If you can't tell what your child is allergic to, your doctor may recommend blood tests or skin tests to test for other allergens.
Can my child become addicted to asthma medications?
No, the medicines we use to treat asthma are not addictive. They can be taken every day and they keep on working. If you have trouble picking up your medicine from the pharmacy or you want to stop your medicines, please talk to your doctor first.
How can I tell if my child's cough is from asthma?
Only your doctor can make a diagnosis of asthma. A cough can be due to many different causes, including a cold virus, pneumonia, or even reflux, or an aspirated foreign body. Your doctor may decide to do testing, including x-rays, spirometry, or special breathing tests, or even a bronchoscopy or an airway exam to determine the cause of the cough.
Should my child use a peak flow meter?
Some clinics use peak flow meters to help patients keep track of how their asthma is doing. So a panel of asthma experts actually found that spirometry, which are just breathing tests, are better to help determine how your child's asthma is doing. Peak flow meters are actually effort dependent and sometimes aren't very helpful in showing us when a child's asthma is worse. So here at UCSF, we don't recommend peak flow meters.
When should my son see an asthma specialist?
A general pediatrician can take care of almost all children with asthma. However, if your child is missing school related to asthma, waking up at night coughing related to asthma, needing to use a rescue inhaler frequently related to asthma, or going to the hospital frequently or emergency room, then it's really time to see a specialist.